Hello, my friends. I'm Dr. Juliana, a geriatric health specialist and physician focused on senior wellness. Today, we're going to have one of the most vital and potentially life-saving discussions about medical tests that are routinely ordered for adults over 70. Tests that, in many cases, may cause more harm than good, and that you absolutely have the right to question before agreeing to them. It's time to bring forward medical truths that are often buried under protocol and habit. Because when older adults understand which tests genuinely improve outcomes versus those that lead to unnecessary anxiety, false diagnoses, and overtreatment, we don't just preserve our health, we protect our dignity, independence, and years of quality living. So welcome to this space where medical awareness takes priority over blind compliance, where informed patients make the choices that fit their bodies, values, and goals. Whether you're over 70 yourself or care for someone who is, what I'm about to share can help you avoid procedures that create complications instead of benefits. Because here's something I've observed through more than 25 years in senior medicine. Far too many medical tests are ordered automatically for elderly patients, often with little discussion about whether they're still useful. There are 7 tests that I believe every senior should question carefully. Tests that are routinely performed but rarely justified by evidence once we cross the age of 70. I hear this question every week. Doctor, I'm 73 and my physician wants to order a PSA test, a colonoscopy, and a full panel of scans. I've heard not all of these are needed. Which ones should I question? That question often comes from people confused by aggressive testing schedules that don't account for age, health status, or life expectancy. And it reflects a growing truth. More testing isn't always better, especially as we age. I want you to stay with me for this entire conversation, because by the end you'll have the clarity to say yes to what matters and no to what doesn't, preserving both health and peace of mind. Medical testing after 70 should never mirror the same approach used for middle-aged adults. The risk-benefit ratio changes dramatically with age. What might detect disease early at 50 could trigger serious complications at 75. But the medical system often fails to adjust, applying uniform protocols to everyone regardless of age or condition. The smarter way is individualized care, testing only when the benefits clearly outweigh the risks. The truth is that one-size-fits-all medicine doesn't work for the human body that's been living for 7 decades or more. The first test to question is the PSA screening for prostate cancer in older men. The U.S. Preventive Services Task Force recommends against PSA screening beyond 70 because it causes more harm than good. Most prostate cancers at this age grow so slowly that they'll never affect lifespan. Yet PSA testing can lead to biopsies, infections, bleeding, and even unnecessary surgery that causes permanent incontinence or erectile dysfunction. Major studies have shown no mortality benefit for PSA screening after 70, but significant harm. Ask your doctor. Given my age, am I more likely to live with prostate cancer or die from it? And what are the actual risks of the biopsy and treatment? The second test is colonoscopy after 75. While colonoscopies are life-saving for middle-aged adults, after 75 the risk of perforation, bleeding, and anesthesia complications rises sharply. If you've had previous normal screenings, your odds of developing a life-threatening colon cancer are extremely low, yet the procedure can be risky. Major physician organizations recommend stopping routine colonoscopy after 75 in average-risk adults. Instead, ask if a simple stool test or less invasive screening might be safer. The third test to question is routine mammography for women over 75. At this stage, breast cancer often grows so slowly that it's unlikely to shorten life. Yet screening can lead to painful biopsies, surgery, and radiation for cancers that never would have caused symptoms. Research shows mammography in women over 75 increases anxiety and overtreatment without improving survival. Before agreeing, ask, if cancer were found, would treating it extend my life, or just make it harder? The fourth area involves overly aggressive diabetes testing and management. Many older adults are pushed to keep blood sugar levels as low as those of younger people, but tight control in frail seniors can cause dangerous drops in glucose, confusion, falls, and hospitalization. Studies now show that looser glucose targets are safer and more effective for seniors. If you're over 70, ask your doctor what range fits your body and whether your treatment could safely be simplified. The fifth test to reconsider is routine CT or PET scans just to check for cancer. These imaging studies often expose seniors to high radiation and turn up harmless findings that lead to further testing, biopsies, and sometimes unnecessary surgery. Research confirms that such incidental findings almost never extend life but frequently cause complications. Ask, what symptom or concern makes this scan truly necessary? And if something is found, would treating it change my outcome? Now let's look at 2 additional tests that deserve equal scrutiny but are rarely discussed. The 6th is routine thyroid screening in seniors without symptoms. Mildly abnormal thyroid levels are common with aging, but most do not require treatment. Overdiagnosis can lead to unnecessary medications that cause heart rhythm problems or bone loss. Before agreeing to thyroid testing, ask, do I have actual symptoms suggesting a thyroid disorder, or are we testing out of habit? And the 7th is the bone density or DEXA scan performed repeatedly in adults over 75 who already have stable results. While bone health is important, excessive scanning leads to unnecessary medication in patients whose bone density hasn't changed meaningfully. Drugs used to treat minor bone thinning can cause jaw problems or digestive issues. Ask your doctor, how would the result of this scan actually change my treatment plan? If it wouldn't, repeating the test may not be worthwhile. I want to share a story that illustrates why these questions matter. A 78-year-old patient once came to me after his family doctor ordered several routine tests: a PSA, a thyroid panel, and a full-body scan. The PSA was slightly high, leading to a biopsy that caused infection and hospitalization. The scan found small lung nodules that were harmless but triggered months of worry. When we reviewed his overall health, it was clear none of these tests would have changed his lifespan. 5 years later, he's still healthy and grateful he stopped pursuing unnecessary procedures. This is the pattern I've seen again and again. Older adults harmed not by disease, but by the cascade of interventions triggered by routine testing. Evidence across major medical journals now agrees. Blanket screening for cancers or chronic conditions in adults over 75 offers minimal survival benefit and often reduces quality of life. Testing decisions must be individualized, based not just on age but on vitality, comorbidities, and personal goals. Before saying yes to any test after 70, ask 3 simple questions. First, what's my realistic life expectancy based on my overall health? If it's less than 10 years, many screenings provide no meaningful benefit. Second, if this test finds something, what will treatment involve and what are the potential side effects? And third, what does current evidence show about this test for people my age with my level of health? You are not obligated to comply simply because it's doctor's orders. You have the right to evidence-based, personalized care. Finally, let's talk about maintaining health naturally while reducing the need for unnecessary tests. Making informed medical choices doesn't mean neglecting your well-being. Gentle, natural support can help preserve vitality and circulation safely. I often recommend organic watermelon extract, rich in natural L-citrulline, to support heart function and energy without the risks of aggressive interventions. And for those seeking broader support, physical strength, focus, and energy, natural combinations like Icarian, Tongkat, Ollie, fenugreek, nettle root, and concentrated L-citrulline have been shown to promote balanced hormones, cardiovascular health, and overall vitality in seniors. You can find more information about these safe, natural supports in the links below. Remember, the goal after 70 isn't endless testing. It's living fully, wisely, and on your own terms. Because health after 70 is about making informed choices that protect both your body and your peace of mind, not surrendering to automatic medical routines that may cause more harm than healing. Stay informed, stay strong, and always question what doesn't feel right for you.